All right, we are good to go.
Yeah, so we just wanted to kind of bring you through this, and I'm sharing on my screen. I'll click through, but Ryan and I can uh, both explain things as we go, and hopefully are thinking behind stuff that comes up. The first thing to kind of note is that really this should look mostly the same, except if you take a little bit of a closer look, um, you'll see we've just visited this great museum called the Awesome Science Museum, which was totally awesome, as I'm sure you assume from its name. And this is we've taken your surveys all from the 34 different surveys that we had, maybe even more if you had multiple sites or multiple exits or something, and put them all into one giant survey that has branching and all sorts of things. So to correctly populate the name of your museum, we put it in the URL up here, the Awesome Science Museum. You just type it in, and then, well, so that means that we have to make sure we get this name right and this link right without any typos, and then, always use the correct link and everything, because it's not set in stone anywhere. It's set by the URL. But we've also defined another variable in the URL, method equals test. We can put anything we want in there. So this is really what we set up to enable these different data collection methods that we are just going to have to do with the COVID pandemic. So some of us sending emails to visitors who, register for time tickets, or some of us are doing on-site data collection with a tablet, but also providing a QR code. So those we could use two separate links if we wanted. So just kind of allowing that flexibility and allowing us to track that flexibility with a variable that gets defined in the URL. And at this point, just based on everything we understood from the COVES pilot, we are going to try to keep all those methods, all the data from those methods separate, just because we know that the sample you get from your emailed survey could be really different from what happens on site, although, it's not like we did the pilot during a global pandemic, so it sort of remains to be seen, but there's a lot going on the back end there. And one thing we hope this will do is make it faster and easier for us to clean the data and get it to you in a timely manner, because we know that's important right now. So let's go through our visit to the Awesome Science Museum. So I'll click next here. This is exactly the same as the old survey. If I were to refresh this and do it again, you would see in 50-50% of the visitors would get the open-ended follow-up to this, but I didn't get it right here, so I should get it after the overall experience rating later. So the first change you'll see from the old COVE survey was there's some new motivation categories on here. So we kept some of the kind of the top 5, basically: fun or entertainment for my group, educational experience for my group, to see a specific exhibit or show, fun or entertainment, spend time together. Those are the same, but we've added these new ones: to return to a normal routine, to support the Awesome Science Museum, to relax or relieve stress, and a different reason. We thought that an open-ended reason would catch anything that we didn't manage to think of here if there was another really important reason for someone to come. And you can still select 2. So you'll see that if you try to select the third one, it just bounces away from that third option. Ryan, is there anything to add about this one?
No, I was going to emphasize the different reason one, because we know that right now it's really probably impossible to capture all the reasons people are doing things or aren't doing things. So I think allowing for the open-ended response will give us some food for thought when we plan future experiences.
So moving on. So here you'll see the overall experience rating. One thing that we did change here was our questions and measures team started thinking about the implications of the word superior, especially now with racial justice and Black Lives Matter protests happening. There was a pretty prominent book that was getting passed around that was called Superior, and it was about race science and the connotations of things like master race or superiority and whiteness. And so maybe an abundance of caution, I don't know, we're not sure if that word on its own in this context would necessarily trigger that thinking for folks. But again, we didn't really see a compelling reason to not do anything, just in case that was, potentially bringing people's minds there, to that place of harm and discomfort. So there was actually some research from this question, the overall experience rating question, that outstanding, when they were piloting it originally, I think at the Smithsonian, was like functionally equivalent to superior when they tested both of the different methods. So we hope that this will give you more or less the same type of data as before, and the 5-point scale with something above excellent still kind of retains the point of the OER question. So here we get to, probably the biggest changes were to ask specifically about what's happening visiting during a pandemic, right? So one of the things that was informing this was, and Ryan can kind of add to this if he wants, but this idea of gap analysis. So like, where were you when you started, and now when you're done with the museum, how do you feel, and how did what the museum did match your either expectations or what you had hoped they would do, to kind of see where those gaps exist and where we can close them. So the first question, just asking the visitor before arriving, what their level of concern was. And I guess, if they're not at all concerned, they're not at all concerned. Could be for a variety of reasons, but, assuming that, I'm guessing a lot of people will have at least some level of concern about, a group outing, either a little concerned, moderately, extremely concerned. And then the follow-up here about, to what extent did the museum actually address your concerns? So, maybe they were very concerned and didn't feel that the precautions the museum was taking were adequate. So what concerns do you have that we didn't address? Or if the museum did address your concerns, just a more general follow-up in case there's more they wanted to add, like, I was really happy to see that all the staff were wearing masks, or, staff were respectfully speaking to visitors who weren't social distancing, or something like that, And I'll just throw out there something we're sort of experimenting with, but are not really sure exactly how it would work, is if a visitor says, like, oh, you did not address my concerns at all, or you only addressed them a bit, it is possible to send like an automatic email, like an email trigger that sends the response to a designated person. Right now, it just sends to me. I was just testing to see if this worked. This is an idea from one of our participating institutions, but I think it is possible. So if there is great interest in that, we can try to work a little bit more to set it up. And, you might have to gather an email address or something from a visitor in order to really follow up. But that is kind of a possibility. Sorry, I'll try not to get distracted by the chat so that it doesn't come up on the window here.
I was just going to say, if you have thoughts or questions as we're going through this, use the chat feature, and Sarah and I will kind of mine the chat to either respond directly or bring it up after Alex goes through all questions, so we can make sure that you don't lose your question and we don't lose our train of thought going through this.
And so then the other kind of category of question here that we heard from our Aztec contacts, that this was really important, is visitors' level of comfort around touching or interacting with exhibits at the museum. And I do know that a lot of museums are planning for museums have different levels of touchableness and hands-on interactiveness in the first place, but then also now are planning to return to different levels of that. I would say at the Museum of Science, we are trying to retain as much as possible, while of course, a lot of our exhibits will be taken off the floor or blocked off or something, but I've heard other folks say that, they're moving to having disposable styluses only. So there may not be any hands-on touching at all, or just a wide variety of situations. So, but this idea in our science museums, where so much of the point in so many different museums is to have hands-on touchable things, what is that like in the pandemic? So people can just assess their level of comfort with doing that. Another thing that, well, I guess I'll talk about it later. But now here's the stay time question, which previously, we would ask folks to say, oh, what time did you get to the museum? And then we would, since we were doing an exit survey, the exit survey would just automatically calculate their stay time. Because of the new flexible data collection options, that's going to be really hard. We can't do that calculation for somebody who's taking it at home on their own computer because they got an email. Or even, if you were at the museum and you scanned the QR code on your phone, but then you left it open and you walked out to your car and then you kind of forgot about it and you can, so it's going to be kind of imperfect. So we're only going to ask this if someone is taking the survey on site at the tablet, if you're planning to do that type of data collection. Otherwise, we won't be able to do this specific calculation today, I don't know, for the visitor. And then we have these, the familiar, please rate your agreement with the following statements. We did remove one of them, which is the restrooms were clean. Felt kind of awkward to ask if the restrooms were clean when cleanliness overall is so much more of a concern. Obviously, you're concerned about the restrooms, but it seemed overly specific. And then to kind of point out, it is still important to know if the exhibits are in good working order, especially with like exhibit maintenance and staff workflows being changed so much. But to not confuse people if a bunch of exhibits are closed for social distancing reasons. So just to say, the exhibits we tried or tried to use were in good working order. And so then a few here, these two are the same. Do you currently live in the United States? If so, what's your zip code? My group included locals only. These are the same as before. We did modify our question about your prior visit because, say, within the last 3 to 6 months doesn't really make sense when most of us were closed for most of that period. So this will obviously need revising again in the future, but just sort of asking in a different way. When was the last time you visited prior to today? Have you been multiple times since the building reopened? Did you go early in the year before we closed? Before, sometime a year ago or before that? So you'll notice as I was clicking through that there was a logic question that was popping up. This is similar to what we had before, where if you said, yeah, I did visit sometime in the last year or so, we'd say, oh, great, how many times did you visit? And rather than try to do a complicated, like, I don't know, rolling, past 12 months, but not including these 3 months. Oh, but for this museum, it's actually 6 months because you were closed for longer or shorter. We decided to just leave it as 12 months and deal with kind of the strangeness of that. It's kind of not a great option either way, but just kind of leaving it the same as before. I'll continue, even though I didn't answer those questions. These next questions should look pretty familiar. Including race and ethnicity, LGBT identification, highest level of education, no changes there. Around household income, this one, as many of you know from your data, was one where this prefer not to say option was most often selected among our demographic questions. So who knows what that will look like now. But to make the mental load of this question as easy as possible for visitors, we chose to ask about, before the pandemic, just what was your household income, because so many people experienced a change in income of some sort. And often it's not a very straightforward one. Someone may have been furloughed for part of the year, or their salary may have been reduced in some way, and then they were laid off, or then they were hired back. And so one of our sites who was doing piloting think aloud procedures for this question found that it was just super confusing to try to ask people, what's your current household income? Just, you kind of go into mental overload unless there was absolutely no change. So to ask before, and then to ask sort of a general question, just, did you experience a change in income? Yes, a decrease, an increase, no change, or prefer not to say. So at least we'll have some sense of, if visitors choose to answer this and if it's important, a sense of how the pandemic has generally affected incomes. And I actually believe that is the end of the changes. That's everything that we changed. All the other questions are the same as before, besides what I've described. Ryan, did I miss anything?
I don't think so. Though I think the one thing you went over quickly, just a quick update on the list of racial or ethnic categories, we amended Asian to include Asian American. So it now reads Asian or Asian American. So that is another update that we've been meaning to make and have now been included. So that is the core instrument. And as we've been talking to some of you in school, first of all, any questions? Do we want to have a discussion around this? Ron, I see your note about, you know, the importance of clean restrooms, and what I was trying to chat in there but didn't get the opportunity to finish was just, you know, anything beyond this. This is a great place for you to think about the specific areas of your museum or the visitor experience that you might want to ask in more detail in your institution-specific section. So what the demo version that Alex just shared doesn't show is all of your institution-specific questions. As he mentioned, we're now using one survey form, so all of your questions will come in a block midway through the survey. And, you know, again, this is your opportunity to probe more deeply than the core survey allows. One of the biggest hurdles we faced in trying to make changes that were appropriate to museum reopening was the very, very different nature every one of us is in, based on geography, based on political climate, based on everything in between, right? Hands-on touchables or anything. And so we felt that we needed to be specific but vague in the COVID page, but we recognize that you might want to ask about restrooms, about your stylus that you're giving to everyone, around hand sanitizer specifically, or mask wearing. And all of those are fine for you to add, and we're happy to talk through them, but those would go on the institution-specific page. Oh, sorry, go ahead, Alex.
Well, I'll just address Jessica's question that popped up in the chat really quickly, which is, are most sites still planning on asking, what did your group see and do? And that was actually something that I thought, oh, maybe that's not as important at first. But then all the feedback I got was, no, that's still really important. Even though we've, you know, maybe we closed all of our theaters or all of our stages or this major exhibit or something like that. It does seem to be still of great interest, even if there are a lot of changes to that question, just based on galleries being open or closed. And I didn't want to forget, what was I going to say? Oh, there was another question we were toying with, an idea of a shared question / optional shared around if folks are developing like new exhibits or programs around the pandemic or around like Black Lives Matter protests and you know, social unrest happening in many cities. I know a lot of us are planning to do at least one of those things, sometimes both, or maybe even other like things happening right now, but those are the kind of the two biggest ones. There was a lot of variability and kind of hard to ask it in kind of an overall shared question. But if you are planning to do that and interested in asking visitors about, you know, whether they expected to see that type of content, or, you know, if they found and were interested in the content that you did produce, that's definitely something we're interested in hearing more from you about, so that we can design that question with you and maybe try to have some agreement across those of us who are doing that sort of thing. Although, I mean, we may not end up getting there, but to kind of try to say something about museums responding to the moment in some way and what visitors are taking away from that.
Okay, so I was going to jump next into the very first thing that Alex mentioned, actually, which was the URL. And he specifically noted that, you know, test was embedded in the web address for this particular version, so that actually, did you even show the last page? Did it say no data were recorded?
It said your response has been recorded, actually, so I don't know if maybe the
so
you tried to put in there.
In theory, what's going to work is every site is going to receive 4 different URLs for your survey. And so this is going to require a little bit more management on your part, but we're going to be very clear about what each one of them are. And specifically, you're going to have a URL that has embedded in it the word tablet or on-site. I think it says tablet. One that says QR, and one that says email. And the 4th one will say test. And the reason that those are important is because you are now having, due to all of the differences across sites, we're trying to provide as much flexibility in data collection methods as possible, but we understand that we might need to separate out the way the data were collected. For example, if you email everyone on site one day and then do random sampling on site the next, that may produce some data differences. So we need to be able to split the data. Because of that, you're going to have different links to be able to do that. But we also want to provide you the ability to test your survey at any given point. So you're going to have the opportunity to do that as well. And obviously the QR code that has been mentioned several times over the last few community of practice conversations, you'll be able to administer that way. But what you don't see on the first page is the data collection form that many of you who have collected data live before are familiar with, right? What did the visitor say? Yes, no, I'm just testing. Previous visitor did not complete survey. And that redirected to another form where we collected some information about either the declining group or something like that, so we could do response rates comparisons or to see if there was a bias in the data. So we're going to provide that link to you separately in a Google form, the same form that you're used to, that will just link to itself that the data collector can use separately from the survey form that the visitor will see. This may create some complication from a tech standpoint if you only have a limited number of iPads or something like that. So I'm going to work on a PDF form too, so you could take out a paper version. But remember that you could also access this on your phone if you needed to do that. We're just trying to strategize a way for you to collect information on declining groups when you collect data using that on-site random sampling method. And then this pivots into a big conversation around some of the unknowns around the data. So we've heard from many of you that on-site data collection is going to be complicated, challenging, or even impossible based on either staffing, state regulations about how many people can be in the building, all sorts of things, which is why obviously there's the QR code and the email method. We can't do that non-response form piece for those visitors. And so because of that, you know, that the non-response form will only apply if you're doing on-site data collection. The other thing I wanted to mention, which is an unknown, which I feel like we've gotten a lot of questions around, are sample sizes and targets. And the short answer here is, yeah, your guess is as good as ours. We have no idea. Typically, we strategize your targets based on your attendance rates, you know, month to month and even weekend to weekday, but all of our attendance are changing. In theory, we would do something proportional to your on-site attendance, but for those of you who get bogged down with other statistics questions about significance or anything like that, you know that there's not a direct correlation between the decrease in attendance and the decrease in sample size. You want to have enough data to support claims. So in the short answer might be your targets might not change at all, even though your attendance is lower, or you might want to collect as much data as you can, even though your attendance is lower. Or I think the simplest thing for us to say right now is you should just do the best you can given what's feasible. And we're happy to have a lot of conversations around that, especially once data start coming in and how we can make interpretations or inferences based on the data. But right now, it's impractical for us to change the targets or do something super complicated with that at all. So we're trying to just head that off. And then if things return to normal, or if we establish baseline attendance patterns for museums once they've reopened, then we can revisit it. Okay, so those were the three things that I wanted to mention about what we don't really know so far. I haven't been monitoring the chat. Are there things that have come up that we should address?
Yes, there's a couple questions in here about, are we planning to get rid of the COVID related questions at any point or go back to the old survey? And, you know, I would say my assumption is yes. It's just hard, obviously sort of impossible to say when visiting any museum will feel like normal again, or even when we'll just be so used to visiting during a pandemic that like maybe that's not the most important thing to ask about anymore. I think obviously when, you know, fingers crossed, optimism, there's a vaccine and we've all been vaccinated and everybody feels safe, like whenever that is, then that would be obviously like, great, we can go back. We don't have to worry about COVID every day anymore. I would assume that at the latest, we would just go back to the original survey then, and the original method of data collection as well. A lot of this, of the pandemic, is affecting our methods as much as our survey questions.
And I think there's another good question from Andrea at Mods about like, are you planning comparisons pre and post pandemic? Thoughts on aggregated reporting? You plan, and then segueing into the returning to the old survey. And those are really good questions. And quite frankly, I don't even think we're there yet. Our hope is that by using this one survey for everyone method, as Alex already mentioned, we can return your data back to you more quickly, strategically, so you can make changes if necessary, so that we have up-to-date information on feelings of safety, perceptions of cleanliness, and that kind of stuff, or any of the specific questions that you add to your individual survey. And in doing so, if there are things that overlap, or even if we just think about those questions specific to perceptions of safety and then like how comfortable people felt touching exhibits, we can report on that in an aggregated sense much more quickly than waiting for a full year of data to come in. So we can send out an update via email or via a blog post and kind of update you all on how people's perceptions across the country are faring for those sites that are collecting data. One of the biggest complications around this is how we interpret the data collected by the various methods. And this has kind of been embedded in the way Alex presented the survey and then his most recent response. But again, if we're collecting data only from an email data capture point of view, there's a strong likelihood that the data will be biased towards people who recognize your or our email in their inbox, or who are willing to take part in that survey even though there was no human-to-human request for data. So there's a lot of conjecture that's going to be embedded into some of that, which we're going to have to talk through as a group. But the strongest points of pre-post pandemic comparison will be for those sites who are able to do on-site random sampling data collection and thinking about what did your data look like before and what do your data look like afterwards, and how and why might we see differences, and what can we say about those differences.
I think another thing, Ryan, that the question and measures team talked about is even if we are collecting in-person data and we're looking at the refusal rates and who's actually feeling comfortable enough to do an in-person survey versus those that visit that aren't. So there still may be some biases of who's actually okay and feels okay doing an in-person survey. And that might change over the course of the pandemic as well. So I think whenever we're sharing this information with leadership, is that we have these caveats around it, that they're, you know, things are just different now. It's not going to always be a exact comparison.
Yeah, that's right. And that came up in an email from Jessica at Science World and in our questions and measures conversation, that these data are fundamentally different, if only because the people who come back are living in a different world than they did when they came before. So there's a lot, probably there's more that we don't know than we will be able to learn even from the questions that we ask, but that's not a good reason not to pursue this, because we all know that if you're in a position of museum leadership or you're not, your museum leaders are going to be asking, broadly speaking, who's coming, or at the very least, are we providing a safe experience that people want to come back to? Can we keep doing this? And are there any specific learning opportunities from the areas that we are providing for our visitors? So there's high value there in doing it any way you can. Brett says, can aggregate reporting be relative specifically to other institutions who collected via the same mode as you? Absolutely. We can break down the aggregate by the method, so we can think through ways of sharing out the reporting, just the email alone or just the on-site data collection. That might be very valuable. And the nice thing is, once enough of our museums open, because I recognize that everything's changing, and even if you plan to open or maybe already opened, that may have changed in the last week or two. As more and more open in the fall, fingers crossed, and more data come in, we can do that more rapidly. So that would be really nice to share out broadly. So even if you're closed or unable to collect data, you might be able to learn from what other COVES sites are seeing. I know that's where you were headed, Brett. Okay, are there any other questions right now about either changes to the core survey, to the possible methods, or to anything that you need relative to the instrument or the distribution that would be helpful for talking through in a full group?
There's one question we missed from Jessica. Can you explain the rationale for asking about change in income? Make sure we're not missing any more.
Yeah. And we talked through that kind of at length, and then we just agreed that that was a good thing to do. So please jump in, Amy or Alex, or I guess Josh and Joe aren't here. I don't know if Elisa is. The reason we changed the phrasing of the household income question, as Alex already explained, is a lot of people's situation have changed. And the problem in making comparisons from the new data to the old data, if we do that, is that we don't know what changes to expect in the future or how to adjust that question 6 months or a year from now if there is a vaccine or making other direct comparisons. And there's a little bit of a sensitivity, as almost everyone on this call I'm sure knows, that question has the highest percentage of people who say, I choose not to give data or prefer not to answer. And so interpreting that right now matters a whole lot, including the follow-up question, if people's income has changed at all. I will say that that is a question that is probably easiest to remove once we get a little bit farther and we see what the data show, or if people are choosing not to answer it, and what insight it's giving us into either instrument changes down the road, or even if it's pricing methods for different institutions based on those data. I really don't know, but that's one that's been encouraged to us just based on general demographics in a COVID world. I don't know what we're calling it. I don't.
Right. I am aware of some institutions that are considering like changing admission prices or prices for different experiences, which they could choose to do that regardless of whether visitors have experienced any sort of change in income, but would be helpful in understanding the impact of those changes.
Great question from Lauren about standardizing the email method once you have the link. So is there a specified length after the visit to set it out, or is it up to each institution? Great question, because we made the decision not to handle any of that. You don't want to be dealing with emailing us your email lists. We don't want to be emailing out 10 billion surveys a day. So we're leaving it up to you and whatever kind of mail distribution system you have. Most museums have something like that. Most of you are probably familiar with it. And we haven't written anything up yet, but I'm happy to crowdsource this. There's two things to consider. One, the email list that you get, whether it's from pre-purchases, ticket reservations online or any kind of time ticketing system, you will most likely need to verify showed up. Otherwise, you're sending a survey to people who had no museum experience and therefore shouldn't be getting the survey at all. So that's going to be a little bit of fact checking later in the same business day. Because of that, it may be practical to do some kind of review towards the end of a day in which you do that and send it out first thing in the morning, or last thing, close of business. We know there's a little bit of a latency issue. One of the reasons on-site methods are generally preferred by visitors is because they respond, oh, things were fresh in my mind, or I can do it now and be done with it. You don't want to wait too long in any instance about emailing it out after the fact. So without setting in stone, this is how you have to do it, I would recommend that you do it towards the end, 4 to 6 p.m. on the same day of visit, or first thing in the morning the next day, depending on what your CRM systems allow. Good follow-up question. Based on Lauren's question, is there a maximum time between the date of a person's visit and when they complete the survey? Can there be a screener question to verify that someone actually visited? Sure, Beth, we could employ something like that for the email method only. If you're unable to verify that the email list you have and the email distribution you send to match up, or that you're actually sending to attendees and not just registrants, in theory, there's no maximum time, and we could talk about this. Having done this in the past, when the Museum of Science first did our visitor experience monitoring project, we did the email method, and we never had a cap on how long they could respond. But we can set the survey up so that it maxes out after a certain amount of time, say a week. We actually have, because we haven't been able to pilot this at all, we don't know if there are any data differences between the recency of the visit, 1 day after, 2 days after, 7 days after, anything like that. So I think that's something that we can come back to after we start collecting some data. Okay.
Do you remember, Ryan, when we used to send the the visitor experience monitoring survey?
It
Or
was automated, I think,
really
at
early
9
on?
p.m. each night
Okay.
because it went directly into the system.
So like the day we collected the emails in person for that. So we were out there collecting emails from people we knew were at the museum. So that's kind of it's a slightly different situation, but at least maybe some kind of a starting point.
And Rosario just posed a question: were questions around ticketing process and time tickets considered? Right. I'm not sure I understand everything you're asking, but we're obviously on the core survey, we're not asking about method of entry or the time ticket process. I think those would be very probably well suited to institutional specific questions. But one of the things that we've always strayed away from is asking questions on the COVES survey that you have more reliable data from somewhere else in your museum. So if you're doing time ticketing or you've got a ticketing process on your website, you know the percentage of tickets that are being sold, the times in which they're sold, and you may not be able to correlate the visitor experience with those different aspects, but you have better information there. If you ever come to the point in which you need to correlate, OER ratings or NPS or demographics against those various time ticket factors, that's when you'd think about adding those ticketing methods back in. But right now, you probably have better sources of information elsewhere.
If the question is sort of around, did you find the process convenient or what were your perceptions of it? That seems like a great candidate for an institutional specific question. We definitely, when we started talking about the gap analysis idea, it was more specific. It was like, asking about all of the specific health precautions that a museum might be taking. And we quickly got to the point where it was so variable for everybody. Like, well, why are we asking about masks when that's not up to us? There's a state mandate to wear masks, or we're not doing any specific social distancing policing of people. We're just asking them to do it. And it was so variable. Some people are and aren't doing time tickets. So the balance there was sort of hard to strike. But for any specific, measures that you're taking, like time tickets, that's a great candidate for an institutional question that we'd be happy to add.
In thinking about institutional specific questions, I have two kind of things. One is when you get your link from Alex and you review your specific instrument, definitely review these institution specific questions. I've mentioned this on the last couple of calls if you've been on the small team chat so far, but this is a good opportunity to revisit what you are asking and why. You are more likely, I'd strongly advise you to ask questions that have to do with health and safety or the current environment that visitors are coming to your museum in, as opposed to some of the more commonplace institution-specific questions of old, like how did you get to the museum, or what other languages do you speak at home? Some of those may be important for equity or access issues, and I think those are very important, but some of them are not, and I think we would all be better suited to strategize ways to get data that are immediately relevant to our reopening operations. And so please review all of your institution-specific questions and get back to Alex and I with any proposed changes. And this would obviously affect, your see-do list, as many areas within the museum have changed. And thinking through that, we are going to just create a Google Sheet or a Google Doc or something that lists everyone's new institution-specific questions so you can all see what those are all the time. Particularly if there are good questions around health and safety measures that you might want to ask. If someone else has already asked it, we're going to share it with you in real time, and we'll have that up as soon as we get any instrument changes from you all. In the meantime, I'm just going to plop a couple of the nationwide surveys that have gone out up online for you to peruse, including the La Placa-Cohen Culture Track Study, which many of our institutions participated in, the Maury survey, which some of our institutions participated in. Museum of Science did one that was conducted by Arts Boston, but there may be some good health and safety questions that you might choose to snag. And then I know at least the St. Louis Science Center has done their own surveying recently. If you've done any surveying recently and you think you've got valuable contributions, we'd love to crowdsource those and put those in there as well, just so we have options, and then we can start thinking through the best ways to get the data that we all need to make a good visitor experience. And then with the last 15 minutes, we were hoping to ask a few of our trusted friends from museums that have reopened to share any insights that they've had so far. I know there are a couple on this call, although they may feel like we've asked them this 700 times already about what the experience has been like. So without calling on anyone specifically, I'll just share that so far, COVES, Sarah, Alex, and myself have had a few small group conversations, which has been really, really interesting because you can get much more personal, and we shared some statistics. But just so you all know, if you're not open yet, reopening museums are seeing anywhere from like 7 to 20% of their typical visitation for this time. The most common is around 15%, but it has fluctuated within that 7 to 20% range. And then beyond that, we've found it interesting that museums are reporting that anywhere from 50 to 75% of these visitors are members. And so this is higher than average, but it's not 100% members. I think at least I had a fear that the only people who would be coming back to the Museum of Science were members. And so it's fluctuating in that 50 to 75% range. We do have a couple museums who are collecting COVES data right now, and they've been utilizing mostly the QR code, a little bit of the on-site sampling. I think at least one of our sites has reported that it's been about 50-50 for visitors who choose the QR code as opposed to using the tablet. And we haven't rolled out the email method just yet, so all of those methods will be available this week for new institutions. But for anyone who's open, if you want to chime in and just say how the museum experience has been beyond COVES or anything specific to visitor evaluation you've done, I'm sure people would love to hear it. And if not, that's fine too.
So we've been open since last Tuesday, and we've been seeing in that 10 to 15% range of visitors. We are requiring advanced reservations, and we found that, maybe 15% of the folks who make reservations don't show up for one reason or another. So that's taking up some slots that might go to someone who would actually show up because we've got a limit of 50 people in the museum at a time. And we are seeing, usually we see 50% members, 50% public. Now it's 75% members, 25% public. So much heavier on the members. So not a lot of income coming in right now. So we'll see how long we can do this.
And you have not resumed visitor data collection yet, correct?
No, very soon.
At the Science Center of Iowa, we have been open now for 2 weekends. Our first weekend was the 4th of July, and it was miserable. But we are doing advanced ticketing. We're only open on Saturdays and Sundays, shortened time slots, advanced reservations, no cash handling. We're doing sort of like a cohort system for our staffing. This past weekend, we had about 20% of our visitation. It was an excellent weekend. And we had about 80% of non-members. And they are not our typical visitation. A lot of out-of-towners. It's super interesting to us that seems like the grand city of Des Moines is becoming a mecca for visitation in COVID. Folks from Minnesota, folks from Kansas, Missouri, that is not typical for us. But a lot of cleaning, and we have not started any kind of formal evaluation at this point. But since there's so few visitors, we're having lots of informal conversations. And we are requiring masks, and we have not had a single complaint about the masks yet.
That's great.
We heard a similar comment from Elisa Israel at the St. Louis Science Center, who's been open for a couple weeks now, about the out-of-town visitors. I think she was pretty surprised to see that the proportion didn't seem to have changed from before closing in terms of who was local and who was out of town. So that's definitely not what I would have expected. And yeah, for you, Renee, that it's even more is wild. Seems unlikely, but people surprise you.
I started collecting data if anyone wants to hear about that. Okay, so I'm Julie Goss at Crystal Bridges Museum of American Art in Bentonville, Arkansas. And I know our visitation patterns might differ between art and science museums, but also maybe not as much. We don't have real data yet. And but the actual data collection, since we did start collecting data on June 17th, I think that's right, because we opened to the public on June 10th again. And we're using a modified on-site protocol where you can collect using our iPad, which sits on a stand that we sanitize in between, or using your own device with a link or QR code. And it's not as awkward as I thought it was going to be. And I think it sounds really awkward when you explain it to someone, but in practice, it really wasn't. So if that helps you feel any better, I hope. There you go. Also, our response rate is down just a little bit from where it typically was pre-COVID. Before it was about 67%. In June, it was 61%, but still overall really positive experiences. And it doesn't even feel down because of the phone method. People taking their phone method, we aren't requiring that they sit right next to us and complete their survey while we stare at them. We are allowing them to leave. And according to our numbers, 52% of those actually do finish the survey. So take that for what you will, but only about half of our phone people finish their survey. And response rate isn't that bad. And it's pretty good. So yeah, if that helps any of you, here you go.
Julie, I have a follow-up question. Oh, can I go first, man? It's quick.
Yeah.
It's around the idea of how much time you're spending at one time on the floor doing that. Are you trying to limit it to like only 30 minutes or 60 minutes or any particular time limit for that?
We went back to our shifts of 2 hours, 1.5 to 2 hours. We're only in the office for data collection. And by that office, I mean like we'd go to the museum and go to the lobby and leave. So yeah, and then there's a question, any feedback from your data collectors about their experience? I've collected some data, but also Rachel, Lindsay, and Kate Metter are on the phone, I think. And do y'all have anything to add about your actual data collection experience? You've been doing it more.
Yeah, generally, I think it's the same. When people opt to take it on the iPad, I'll sort of say, oh, you know, I've been sanitizing it between uses, no worries there. And they usually just kind of look at me as if that hadn't occurred to them. I've only had one person say, oh, okay, cool, like good. So really quite the same. There's only been a few times where people have had a hard time understanding me through the mask.
Oh yeah, we wear masks and visitors wear
yes.
masks. Everybody's wearing masks.
Everybody's wearing masks. And so, but it's been fine. Generally, I think it's really similar. Yeah.
And Julie, I was going to ask, is there a scenario or a world in which you would encourage visitors who choose the QR code to sit down and finish it on site so that we don't have that 50% drop off? Or is that a crystal bridge too far to get?
I don't know. The most we've done now is if they sort of like hold up their phone to get the code, we verify that it actually comes up, so they're not just like, okay, see you, bye. So we say things like, oh, can I just make sure it came up okay, and have them kind of like show us. And we also offer the bench, so it's like, oh, and you, because it is right there. So we say like, and you can use our iPad, which we sanitize in between, or on your own device using this QR code, which you could complete if you want to sit right here, you know. But I don't know if we'd ever say like, here, now do this and now sit right here. It just seems a little like an extra awkwardness at the end of a visit. Also, what happens after people leave that spot in the lobby is that they can go to our museum store. So it's very possible that another person in their group is perusing the store while like they are completing it while they're walking around. But right now, I just think it's a better visitor experience. But I can take pushback on that if you tell me it's a terrible plan.
No, Elisa from the St. Louis Science Center has also experienced a similar drop-off in the QR rate, even though it's not the COVES survey, just those preliminary visitor feedback efforts. And I think she was basically saying that she was saying like, oh, if you want to hang around, I'm happy to answer any questions you might have about the survey. Just like one slight nudge, but agreed that it's that awkward, you know, sit here so I can watch you do it and make sure you submit it, that we don't want to get into. And it's also really not necessary, even for our response rates. So I was just curious if you had thoughts. Carla, I noticed you asked a question about printing instructions. And as Alex has just pointed out, there are a few sites. Crystal Bridges was the first to do it. We have since followed suit, particularly to promote the QR code option. So you can have it printed visible and large enough where it's easily accessible. We are printing instructions bilingually. So we think that's a great idea, and agreed, the use of a face mask, while essential, is going to prohibit some amount of communication, or at least complicate it. So printing instructions is a great idea. We'll reach out to Julie later to see if she's comfortable with us sharing what she's designed. We're happy to share the Museum of Science's draft sign, which we just got a copy of, just as examples in case each site wants to do their own or steal ours.
Yeah, and my hope with the sign is, and I don't know if this is maybe hopefully the experience that Rachel and Julie and Kate are having, is that, you know, the experience of seeing a person right there who might approach you might still be kind of weird, but that a sign is like, here's what I'm doing. Hello, like, tell us about your experience. And so that will, people might be able to see it from far away, and it'll kind of put them at ease as they approach you, to understand like what the heck you're doing standing there, if that's how you're doing data collection.
Okay, any final questions? We're getting towards the bottom or top of the hour, depending on how you think about it. And I just want to make sure that everyone feels comfortable, at least with the information we presented about the instrument and the methods, and some of the reopening stories that we've heard. Again, we do recognize that even if you've told us your reopening date, there's a good chance that it's changed, so totally okay. And again, we've got at least 3 more small group calls that we've scheduled, and we'd be happy to do more if there are other people who have not had the opportunity to do that.
I did want to, we talked about this, Ryan, before, but previously we were collecting like refusal demographics for people. So we had this very clever setup on the survey where you would select the visitor's response and then you would give them the iPad, and then that completely broke down. We are hoping that we'll still be able to do that. It's just that on a separate device in some way. So we need to like make sure we're not wrong about that, because I've thought through it like maybe 90% of the way, so it could break down still. But hopefully it would still work for you to do that, and we would still be able to calculate response rate. It's just that you and the visitor wouldn't use the same iPad. You would could even use your own phone or something like that. So trying to calculate response rate is going to get a little bit more confusing, but if you are doing on-site data collection, we're hoping that the basic method of putting in the visitor's response, if it was a no, and saying, did they have kids, or, was it just adults, would still mostly work. So we'll try to provide more concrete guidance on that, but we are trying to keep that in place.
And Jessica asked a really good question that's kind of related to that data collector logs. Are we collecting whether the visitor scanned versus completed on site? I would suggest tracking your number of on-site people who leave with phone. Julie, do you mean that just doing a simple count of people who acknowledge the QR or tried to set up the QR as a yes, right? And then,
yeah, sorry, that's not clear. I meant like when they accept and say yes and take the QR code and leave, having that number compared to the actual number that came in of completed on their phone, let us see that response of 52%. So if we hadn't been tracking it as the data collector, we wouldn't have been able to tell.
We are setting up with the tag in the URL to say that, it was a QR code versus they were doing it on the tablet. So that'll be one way to do it. And hopefully that will help as well.
Okay, well, this has been great. Thank you all for joining us today and listening to us share some of the developments for COVES. We hope that you're all doing well, and we wish you best of luck with reopening on whatever schedule that means, and particularly good luck with your visitor evaluation. Again, we're having those small phone calls. If you've got additional questions beyond this, please do reach out to Alex, Sarah, myself. And yeah, good luck, everyone, and thanks again. Bye.
Thanks, everybody. Bye.